Hello, Fit for Life spinal cord injury support group members. My name is Steve Lister and I'm a physician assistant. I work in cardiovascular medicine and am a health and wellness enthusiast. I'm going to be one of our health coaches on our journey to be fit for life, and well, we'll be starting off our journey with a little bit of education and setting some movement goals for us to follow. When starting any activity, you are building a pattern, a good habit. To reinforce good habits, they take repetition. So the first exercise goal is going to be to do this routine for up to 4 to 6 weeks to reinforce the habit. Old habits are hard to break, and that's why we're here. Let's support each other and be committed to building good habits and being the best we can. Our movement goal is going to be universal and can be translated across any fitness level from beginner to intermediate and on into the advanced level. We're going to try to move for 30 minutes continuously most days of the week. This is a modified recommendation from the American Heart Association and the American College of Cardiologists, who recommend 30 minutes of moderate intensity most days of the week, which translates into 150 minutes of moderate intensity exercise weekly to reduce your risk of cardiovascular disease. This same principle can be applied to a more vigorous routine of 75 minutes of vigorous activity for more advanced cardiorespiratory fit people, or can be further broken down to shorter interval training, usually between 2 to 3 sessions of 10 to 15 minutes per day for the beginner. Now that we've outlined our movement goal, there are a couple things that we need to know. First off, how to calculate our heart rate. It's very simple. What we want to do is turn our hand up to the sky, run our finger down right under our thumb, right between the radius, right here, and you're just going to lightly press it there. We're going to count the number of beats in 6 seconds, and we're going to multiply it times 10. Once we know where our heart rate is, we can calculate what our max heart rate should be. We want to exercise at a percentage of that. That percentage will be based on where we are in our fitness journey. For the beginning phases, we're going to take 65 to 75%. So we'll start our cardiorespiratory fitness training with a 5 to 10 minute warm-up, which will incorporate some stretching, some core stability movements. Stretching is going to be, static stretching to start out. It's a very beginner stretch. It's taking the muscle through its full range of motion, finding an area of tension, holding it up to 30 seconds. As a beginner, you want to do 1 to 3 sets, kind of doing, stretching motions for 30 seconds and going through your whole range of motion for all the muscles in the upper body. For us in wheelchairs, it's going to be important that we do range of motion stuff with our rotator cuff, anything to do with the shoulders. If we're pushing the chairs all the time, we're going to be front tight, our chest, our triceps. So, tricep stretching, just bringing it up, holding it for 30 seconds, straighten it out, do the same thing, all over. You can use a chest stretch, kind of leaning into it, opening up 90 degrees, leaning into it. You'll feel a stretch through your chest. And then we move on to core training. So to activate our core, these are very simple concepts but need to be emphasized. So to activate my core, I'm looking at my transverse abdominis. For those that can activate the transverse abdominis, it's the best core muscle because it's like our natural gait, or our natural weight belt. I want to suck my belly button in, almost like I'm trying to look skinny in the mirror, but I want to suck it in and still be able to breathe comfortably. So for those that can activate that, that is going to be something that I want you to focus on during the warm-up. If we don't have transverse abdominal function, we still have our diaphragm, which is also a core muscle, and you can utilize it unless you're vent dependent, in which none of this routine would be utilized for you. So by taking a deep breath in, finding a comfort spot where you can still breathe in and breathe out more, it's going to give you an opportunity to utilize this muscle. We'll then move on to our conditioning phase, which will be 20 to 30 minutes. During this time, our target heart rates will be between 65 and 75 beats per minute, like we were talking about. We'll finish our routine with a cool down of 5 to 10 minutes, focusing on stretching the muscle groups that we just activated and trying to bring them back into normal joint alignment and length to prevent misalignment and possible injury. Thank you guys, and we look forward to seeing you for our next podcast, where we'll move along to cardiorespiratory training 2. Good morning, Fit for Lifers. Here we are, it's 5 o'clock. Monday morning, we're starting our fit move goal this week. We're going to just be starting off with some stretching, moving your body through normal ranges of motion, holding each stretch for approximately 30 seconds. 1 to 3 sets. Just keep everything moving, keeping everything loose. We're going to keep our transverse abdominis tucked in. We're keeping our diaphragm tucked in. We're going to keep a normal breathing pattern through our stretching. You know, every day in the wheelchair we're, front loaded. So, just keep focus on your rotator cuffs, shoulders, keeping your arms down, bringing them up at 45 degrees, going through nice ranges of motion, getting that subscapularis muscle working. Bring it up, hold it, bring it down. Everything's in line, keeping that belly button tucked in. We can go from here into some internal and external rotation. Holding your stretches for 30 seconds if you can. For time, we're not going to really move through a 30-second hold. You can kind of bring the same motion to the external rotation side, bringing it out. If you want to get a little bit extra of a stretch, you can kind of lean into it. External rotation, good stretch, and grab the door, kind of lean into it, stretching out that latissimus muscle, reaching up high on the door frame, just leaning into it, just letting your body weight fall forward, feeling a nice stretch. Once you feel the stretch, holding it for 30 seconds. Doing this on both sides of your body. Move into the pectoralis stretch, 90-degree angle, leaning forward, feeling the stretch across the pec muscle. Good. Remember all the times we want to activate the core. The core is our base. Once we can activate the core and have good core stability, we're going to increase our muscle endurance. So that was give or take a 3-minute warm-up. I'm going to just keep my hands moving, frontward hand cycle. I'm going to do this for a minute. Gives us an opportunity to do something in the house if it's cold or wet outside. Ideally, if we can get out, get around, get pushing, that would be in the ideal situation. Just getting out, getting active, getting moving. After I do this for a minute, I can always reverse it. Try to do this for a minute. The 2-arm hand crank is a little bit different of a variety, just because it has a lot more forward force, so it pulls my body forward a little bit out of alignment, but it keeps that belly tucked in. We can reverse it, just a little bit of variety, just to kind of keep us moving. Exercising can be a little bit repetitive and might get a little boring at a point in time, but if we keep that move goal at 30 minutes of continuous movement, keeping our heart rates up, trying to get to that 65 to 75% mark, 65% for more the novice beginner, 75% of the target heart rate like we calculated earlier for the more advanced. Then we can kind of come into arm circles. Remember, focusing on the core. Reverse it. You know, you'll start feeling these, getting your shoulders warmed up.
Talk. Yeah, I was worried something was wrong. No, nothing wrong.
So remember this week, even if it just keep moving outside, taking a push around the grocery store, taking a push around the mall, keep moving. Let's keep our move goal active and healthy. We're going to try to increase our cardiorespiratory fitness for the next 4 to 6 weeks, increasing our core strengthening. We'll be progressing on to more advanced workouts as we go, hopefully helping everyone get to their weight loss or body image goal. Have a great day.